Okay, good afternoon, everyone. Today I'm going to present an interesting case of September 2024. Our patient today is a Thai 35 years old female. She presented to the outpatient department. The patient's chief complaint was multiple rashes on trunk and all extremities for 1 day. Okay, so now I will um present illness. 3 days before visiting the clinic, she
Excuse me, may I interrupt here? Is it generalized rash, right?
yes
Generalized, generalized or multiple?
um generalized rashes.
So you make sure that your definition is on point.
Okay, thank you, teacher. Generalized rashes on
Say that. Oh, I beg your pardon. Dr. Kim. Generalized. Generalized.
generalized.
No, not generalized. Just generalized.
Okay, okay, generalized.
Generalized.
Okay.
Dr. Kim.
Oh, okay. So I represent person units. 3 days before visiting the clinic, she experienced high-grade fever with continuous muscle pain. She claimed not to have been coughing or having been experiencing a running nose. She claimed not to have had diarrhea, felt nauseous, or vomiting. She claimed no abnormal urination. She claimed not to have developed any rash or joint pain. She took ibuprofen and the pain subsided. 1 day before visiting the clinic, she felt an itchy rash developing on chest, trunk, each arm, and on each leg, respectively. There was no rash on the face, palms, the soles, and no ulceration of oral cavity or genital area, and also no blistering. The initial rash did not diminish. She experienced low-grade fever all day and muscle pain. She complained of mild itchiness and red eye affecting each eye, but without any pus. She also complained of pain in her ankles, knees, hips, shoulders, and in the hands. The pain in is intense and concurrent. No joint swelling, redness, or morning stiffness. Her mother had also been experiencing the same symptoms. She claimed not to have been changing medications or using any new medications. She claimed to have not been in contact with anyone infected with dengue, but her house was located near forest. So, past history. Underlying disease, adenomyosis, post total laparoscopic hysterectomy and bilateral salpingectomy in 31st in January 2024. Allergic rhinitis. Current medications is cetirizine and pseudoephedrine for when she have a rhinorrhea. She denied taking any herbal or traditional medications, and she denied taking any over-the-counter medication. Drug allergy, eterococib. When she take it, she present swollen lips with fluid-filled blistering. Metoclopramide. She have symptoms palpitations. Personal history. Social drinking have once or twice a month, claimed to be a non-smoker, claimed no history of recent sexual intercourse or unsafe intercourse. Occupation, she is a nurse aide at Queen สว่างวัฒนะ Memorial Hospital. Claimed not to have been traveling outside Sriracha during the past 3 months. And she had history of COVID-19 infection in 18th of April 2024 on. Thank you. Okay. Physical examination. What area that you want to that you want to examine, or you want me to present?
The microphone's not working.
Hello.
The area that I want to determine is skin to see the lesion.
Okay, thank you. It have generalized maculopapular rash on trunks and extremities and spare palm and soles. I will present the pictures here. Okay. Okay, so I will present the physical examinations. On examination, the vital signs were stable, and the patient was well cooperated, no pale complexion, no jaundice. There was no pale conjunctiva and icteric sclera, but she had conjunctival injection both eyes. No mucopurulent discharge, Koplik spot, or any oral ulceration. She had no enlargement of tonsils or exudate, or and she had no non-palpable lymph node at occipital or posterior auricular area. CVS, regular full pulse, no active precordial. Apical index at fifth intercostal space, mid-clavicular line, no heave or through, normal S1, S2, and no murmur. IS, normal chest contour, equal chest movement, clear and equal breath sound each lung, and no adventitious sounds. Abdomen, no distension, normal active bowel sound, soft, without any tenderness, guarding reboundedness, or hepatosplenomegaly. The fifth test was negative. KUB. Kidney could not be palpated. No.
Palpated.
Kid-
Palpated.
Thank you. Kidney could not be palpated. No CVA tenderness. And neurological examination revealed no focal deficit. Cranial nerve ghostly intact. Motor and sensory ghostly intact all. And no stiffness of neck. This picture shows conjunctival injection both eyes. Okay. The floor. Can you summarize some pertinent finding from history taking and physical examination? Or maybe you can group to problem list. It's okay.
The patients have a fever with rash and a conjunctivitis.
Okay. Thank you. Okay, I will summarize in pertinent finding quickly. positive findings from history taking is high grade fever with myalgia. It's like viral prodrome symptoms and history of taking ibuprofen. She has itchy legs developing on chest, trunk, arms, and legs respectively. The pain in the ankles, knees, hips, shoulders, and the hands, and it occurring currently all. Her mother had the same symptoms, and the house was located near a forest, and the underlying is adenomyosis and allergic rhinitis. Negative findings. She had no upper respiratory tract symptoms, GI symptoms, UTI symptoms, and she denied any herbal traditional medication and over-the-counter medication. She denied touring outside Srirasha during past 3 months. And from physical examinations, positive finding is conjunctival injection each eye, generalized maculopapular rash on trunks and
May I interrupt here a little bit? I think the information is maybe a little bit too much because you present both positive finding and negative finding, which you have already informed previously in the history and physical exam. So I think to make the presentation more concise, maybe you can make a problem list or include only positive finding, which we will discuss later in the differential diagnosis, and let the audience discuss why they make the differential diagnosis of this disease because positive finding and negative finding. So I think it is a little bit too much information with like the same information as you have already present.
Thank you, Teacher Kim. Okay, the problem list is first a Thai adult female presented with acute onset fever with pruritic generalized maculopapular rash along trunks and extremities with bilateral symmetrical polyarthalgia with non-purulent conjunctivitis. Second is a history of sick contact. Patient's mother had similar symptoms prior to patient's onset. And third is underlying disease, adenomyosis with post-TLH and allergic rhinitis. Okay. And summary symptom is it's like a acute fever with rash. And so now the floor, do you have a differential diagnosis or can you approach the patient presented with acute fever with rash or any idea?
I direct this to the floor, or I put this to the floor. That's what you say.
Okay. Okay.
So the acute fever with rash mostly come from the viral infection. So I think the most common that we see here, the first differential diagnosis might be in the dengue infection. And then patient also have a polyarthritis.
Yeah, polyarthalgia.
Polyarthalgia. So the second I might think of is the chikungunya virus infection.
Thank you, the floor. Okay, so now we have differential diagnosis into two disease. First is dengue infection, and the second is chikungunya infection, right? Okay, so now I will present the approach of fever with rash. Okay, fever with rash in the immunocompetent patient. The first one that you have to do to look for is characteristic of rash. Maybe it's have a macules, papules, or nodules or plaques, or vesicle bullae or pustules, or purpuric macules, purpuric papules, or purpuric vesicles, or maybe the rash followed by widespread erythema with or without edema or desquamation. All of these characteristic is it have a different disease. And I have put some example in the slide that give to the plot. The second one is etiology. Like friends Deep said, the most common acute fever with rash is from viral infection, and the other infection is like bacterial, fungal, or parasite. The non-infectious is such as an autoimmune, drug allergy, or hypersensitivity. The third one is accompanying signs like arthritis or arthralgia, desquamation, lymphadenopathy, at cervical lymph node, generalized HILA or any local lymph node, meningitis, mucosal membrane lesions, ulcerations, or vesicular stomatitis, palm sole involvement, rash predominantly on extremity, pulmonary infiltrate.
Lymphadenopathy.
Lymphadenopathy. Thank you, teacher.
It's like music. It's very much like music when you pronounce it. If you remember that, it helps.
Okay. And the last one is history taking and concerns like season, geography, incubation period, exposure history, arthropod exposure, medication history, immunization history, or sexual history. Okay, in this case, patient with fever with MP rash, it can divide into source from infection and non-infection. Infection is from viral or bacteria. The viral infections is dengue, chikungunya, or measles, rubella, or Zika. Bacterial infections such as rickettsiosis, leptospirosis, or meningococcemia. In non-infection, maybe drug allergy or autoimmune. The example of drug allergy such as a drug hypersensitivity or 4S disease, staphylococcal scalded skin syndrome. And in autoimmune is SLE, erythema multiforme, or dermatomyositis.
One thing. Divided can be. You have when you use a modal verb. Can, could, should, would. Can be divided.
Can be divided.
Yeah. Be divided. Be.
Okay.
Yes, that's it.
Okay. Thank you, teacher.
Not can divided. The main verb is missing.
Okay. Provisional diagnosis is acute viral infection. And differential diagnosis is as Jeep said. So I will present a differential diagnosis and maybe the symptoms that uh that the reason why I think it is in this disease. The first one is chikungunya virus infection. It have a acute onset of high grade fever, pruritus, MP rash on trunks and extremity, and maybe at palm face also. Bilateral symmetrical polyarthritis and non-purulent conjunctivitis, but it's less common in chikungunya. The second one is rubella. Rubella have acute onset fever, have arthralgia, and rubella have MP rash developed after 2 or 3 days of fevers, and rubella is most common in young females. But the reason why is less likely rubella is the rubella rash always start on face and become generalized within 24 hours. And Dubella will have a lymphadenopathy at post-auricular and occipital area. Rubella.
People want someone to say rubella.
Rubella. Okay. 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 Thank you. It's okay. Thank you, teacher. Okay. The third one is Zika virus infection. In Zika virus infection, it have acute onset fever, pruritus, MP rash, polyarthralgia, and have conjunctivitis. And the fourth one is dengue fever. Dengue fever have an acute onset fever, pruritic MP rash, arthralgia, and conjunctivitis too.
Dengue fever has an acute onset,
Mm.
or there is an
Hmm.
acute onset.
Okay.
Not have,
Has.
or there is.
Okay. Thank you, teacher. Okay, next
So,
part.
before we move on to the investigation, I would like all the residents to review onset and clinical progression of each infection that Mac has already present in this slide. If you I have seen that there is the diagram that is a chart that onset of fever, onset of rash, pattern of rash, to like to make it more clear. If you look at this table, maybe we don't see the big picture of each disease, but there is like diagram and chart that point out that the fever, the onset of rash, and any other symptoms, it will can make you see a clear pattern of each disease. And another thing is that from the differential diagnosis, you can group into the flavivirus, I mean the arthropod-borne infection in the chikungunya, Zika, and dengue fever, and another form like rubella infection, which is a different types of pathogen, right? Maybe it's hard to differentiate between chikungunya and Zika and dengue fever. The manifestation is very similar. Okay.
Okay, thank you, teacher Kim. Okay, next part, lab investigation. In lab investigation, maybe it may be divided into basic lab and specific lab. Okay, so I will ask the floor that which lab you want to send, and maybe what is the result that you think it could be.
First lab investigation that I would going to send is complete blood count. The result of complete blood count that I want to see if it is a dengue fever. The CBC will have decrease of platelet and the white blood cell count will be decreased and the hematocrit is increase.
Okay. Thank you, Jeep.
Platelet.
A consonant T
Uh-huh.
followed by a vowel.
Mm-hmm.
E or I.
Platelet.
It becomes the vowel before the consonant. It's kind of like a game of drafts where you're protected if there are two draft species. You know the game drafts.
No.
It's where it's a board game and you have pieces of it, you can hop over them, but you can't hop over when there are two. It's very much like that. It's the letter sound is protected if there are two consonants there. Two T's, it would be flat.
Okay.
But because there's only one, it can't. It's the vowel before.
Okay. Uh-huh.
Okay. Thank you, Chip. So, okay, in this case, basic like investigation that has been sent is CBC, beyond creatinine, liver function tests, and has CRP too. The result is white blood cells a bit decreased, and hematocrit and hemoglobin a bit decreased. Yeah, and renal function test is normal, liver function test is normal, and CRP is a bit high. Okay. And specific lab for the disease that you have a differential diagnosis. Okay, I will present. First is chikungunya virus infection. The specific lab is RT-PCR for viral RNA, and maybe serology test of chikungunya virus. The second is rubella. Rubella have a RT-PCR too, and have serology test too, is a IgM and IgG. Zika virus have RT-PCR and
PCR
RT-PCR in serum and urine, and have serology test is IgM, and dengue have NS1 antigen and IgM IgG.
May I ask the presenter, will you send all these investigation or just pick up some investigation?
I will pick up only some investigation first, like in
And may I ask other resident which investigation would you pick in this case?
Sorry for Dr. Kim. This is Supanan speaking. This is my case. Yes, at first I sent CBC dengue profile and when I see this case is a fever with rash and list of chikungunya and Zika infection, I consult infectious control department and the infectious control department advise me to send RT-PCR for chikungunya virus serology and Zika virus RT-PCR because of this patient is young and have risk to transmission to other because she is a healthcare worker. Yes.
And also rubella or only the flavivirus?
No, rubella is at the end is a cancer lab because of the cause.
Because of the cause of the lab. Okay. Thank you, Dr. Supanan.
Thank you, อาจารย์ Kim and อาจารย์ Nan. Okay, the result is okay. Chikungunya RT-PCR is negative. Okay, and Zika virus RT-PCR is in urine is positive, but in serum is negative. And dengue and S1 antigen negative, and dengue IgM IgG negative. Okay, rubella IgM negative. Okay, so definite diagnosis in this case is Zika virus infection. Okay, and management, because Zika virus is a viral infection, this case have a supportive treatment, have had adequate hydration, adequate pain control, and symptomatic treatment. The med there was okay. Okay.
There may be, there might.
Okay. there was adequate adequate hydration, adequate pain control, and symptomatic treatment. The medication were and were paracetamol, topirazole, tramadol, Voltaren, cetirizine, and ORS. Okay. In this case, clinical gradually improve, and I will skip this part, like gradually improve, and then it clearly and it's improved out around 1 week. Okay. So okay, this part I will discuss that I will be discussing about Zika infection. Okay, background about this disease. Okay, Zika virus is a single-strand RNA in the genus Flavivirus, and is related antigenically to dengue, yellow fever, West Nile, and Japanese encephalitis viruses. Zika virus is a mosquito-borne and transmitted by Aedes mosquitoes.
Mosquito. Mosquito.
Okay,
Mosquito.
mosquito. Okay, Egypt, the mosquito, right?
Mosquito.
Mosquito.
A Q there.
Okay,
I think it's a C. Mos. A K is better.
mosquito.
No.
Okay, it's a data mosquito, and it is a same vectors as dengue, chikungunya, and yellow fever viruses. Okay, the primary mode of transmission is through the bite of an infected Aedes mosquitoes. Other modes include maternal fetal transmission during pregnancy, sexual transmission, blood transfusion, and laboratory exposure, and maybe in breast milk, but it is in research. Oh, okay. Clinical manifestation. Most people infected with Zika virus are symptomatic or are asymptomatic, but when symptoms occur, they have symptoms such as fever, pruritus, maculopapular rash, arthralgia, and conjunctival hyperemia. And the less common, but also have symptoms such as myalgia, headache, edema of extremities, vomiting, retroorbital pain, and lymphadenopathy. Laboratory abnormalities is uncommonly. The lab results is a bit as same as dengue infections is thrombocytopenia, leukopenia, and might increase liver transaminase. Other important complications of Zika virus infection is Guillain-Barré syndrome. The other complication, but rare, is meningoencephalitis, myelitis, and uveitis. The incubation period of Zika infection is about 3 to 14 days after bites of an infected mosquito. Okay.
Okay. Oh, I beg your pardon, sir. You hadn't finished that side. Go on.
Okay, with 50% of symptomatic case developing symptoms first week after exposure. Okay, teacher.
Okay, 2 points. One is the way you pronounce words like a something, not asymptomatic, asymptomatic, asynchronous,
Symptomatic.
can't think of other ones at the moment.
Okay.
And also the word uncommonly, laboratory abnormalities, uncommon. It's not uncommonly. Occur uncommonly. Occur how uncommonly. it's not an adverb. It's an adjective. Correct. Yes.
Okay.
Just little points there.
Okay. Thank you, teacher. Okay, this slide is compare clinical features of Zika virus to dengue and chikungunya infection. The one that Zika is different from dengue and chikungunya infection is conjunctivitis, and the other symptom is maybe the same, such as fever, rash, arthralgia, myalgia, headache. But dengue is have more severe symptom because it can have hemorrhage and have shock. Okay. Diagnostic test as I present before, is first Zika virus RT-PCR assay. This data is from Red Book 2021. It have updated in Thai. I will present it later. Zika virus RT-PCR should perform on serum if it have symptoms less than 5 days, and in urine it have symptoms more than 5 days, and all specimens should be collected less than 14 days after onset of symptoms. Serum IgM antibody testing should be performed if RT-PCR result is negative, or after 14 days have passed since illness onset. But due to Zika, dengue, and chikungunya shares a similar geographic distribution, so suspect case should be evaluated and managed for possible dengue and chikungunya virus infection. And negative RT-PCR and negative IgM antibody cannot rule out infection too. Okay, this is a only case classification is from Department of Disease Control Thailand 2024. It's published on February this year. Suspected case is all patients include pregnant women with MP rash and one of these following symptoms: fever, arthralgia, headache, red eyes, or physician suspected Zika infection. Newborns aged less than 1 month with head circumference less than 3% height compared to same age and same sex. The measures should be performed average 2 times in 24 hours. And Guillain-Barré syndrome patients with acute polyneuritis and symmetrical acute flaccid paralysis. Probable case is a epidemiological data related to patients living in the area or traveling to the district with confirmed case in 28 days. Dengue and S1 antigen negative in 3 days after symptoms. And the last one is laboratory of measles, rubella, dengue, and chikungunya, all negative.
Okay. Quick question. Quick point. When you refer to percentiles, you don't say 3 percentile. You say you use the was it the third percentile? I was trying to remember which one it is. What's it? Ordinals and cardinal numbers. Ordinal is the one that you want.
Okay.
If you're saying the relative position, the first T nung and so on, yes, that's the ordinal number, and that's what you're saying there. If it's less than or lower than the I would say
Okay. Lower than third percentile.
Yeah.
Right.
Or in a percentile, which is lower than the third. That's a better way of saying it. But anyway, yeah.
Okay.
I think people understand what you're saying.
Okay. Thank you, teacher. Okay. And okay, this picture is presents about pregnant patient with Zika virus infection. About 70 to 80% neonate have an infected, but about 20 to 30% is have symptoms, maybe fetal loss, congenital Zika syndrome, or asymptomatic. Congenital Zika syndrome is a syndrome that the neonate have symptoms as microcephaly, facial disproportion, hypertonia or spasticity, hyperreflexia, seizures, irritability, arthrogryposis, club feet, ocular abnormalities, and hearing loss.
Spasticity. Spasticity. It's
Spasticity.
very difficult to say.
Spasticity.
Yeah, that's it.
Okay.
Spasticity. That's it. Very
Okay.
difficult.
Okay. This flow is an evaluation of infants with possible congenital Zika virus infection. First is about
Sorry for interrupt. I
yeah.
think the time is so tight. I think you depend on Thai guideline.
Okay, thank
Yes.
you, teacher. Okay,
Me speaking too much.
Okay, Thai guidelines about for lab investigation for our patient that you suspected Zika virus infection or have some clinical ones of these below. First is have related to patient that have confirmed case or traveling or living in district that have confirmed case or have an NS1 dengue, measles, rubella or chikungunya negative. First is normal patient that is not a pregnant woman. If symptoms less than 7 days, should be collected serum and urine for send RT-PCR.
Sorry, Nong Mac. I think if you found the case that suspect Zika virus infection in practical, I think if you suspect and you should consult about infectious control department, and infection control department will select appropriate the lab for each patient for you. And in this case, it's too many lab because the patient working in OBGYN department. Yes, it very high risk to pregnancy women who
I
yes
understand.
you see, okay. And if you found is like this case, you will send basic lab and dengue to rule out dengue infection and consult about infectious control department in the hospital. You call operator and direct to infectious control department, and they will select the lab for you. And they will infectious outbreak surveillance. Yes.
Okay, thank you, teacher. ได้ครับผมเอาหน่อยไหม
It's a question of passing this, getting guidance or direction from different parties, yes, the ones that are appropriate, that will give you the right information.
Yes.
Okay, this is examples of Zika virus guideline in Thailand for record data. Okay, and management of Zika virus infections, initial assessment and treatment. First is no specific antiviral therapy, and you should supportive treatment such as advice for rest, fluid, adequate fluid, hydration, maybe add some medication for analgesics or an antipyretic drugs. And if has suspected Zika virus infection, should be evaluated and managed for possible dengue or chikungunya virus infection too. And you should avoid aspirin or other NSAID due to dengue can not be ruled out to reduce the risk of hemorrhage.
Right,
Okay.
the way you should say that, by the way, that second bullet point down, supportive treatment should include rest, fluids, analgesics, and antipyretics. Should include. Is better than IE.
Okay.
IE means id est, that is.
It's finished. Thank you. Thank you. Thank you for your attention. Thank you for your attention. And anyone have any question, it's okay.
I have information for tell everybody that about incident about Zika infection in Thailand. Yes, in July 2024, in Thai Ministry of Health report is have a case 243 Zika virus infection. Yes, it's too many. Yes, in Thailand. Yes, but this incident, yes, nationwide, but this number is epidemiologist think this is under report because yes, because the lab is yes underestimate, yes, because of this cost of the lab is so high. It's about 1,000 and 500 to 2,000 baht. About send a Zika virus. You can send it free if you have a cluster and like this case have a same symptom in the house or pregnancy woman only. So normal people not who not have money not send this lab because this treatment only supportive treatment and follow up same like yes. Yes. Okay. And if about protocol about infectious control department do with have a Zika virus infection when it have case in the hospital, they will detection and isolation the patient for decrease the transmission of the Zika virus, especially among pregnant women who are high risk because they lead to the microcephaly baby. Yes, and they will vector control eliminate the mosquito. Yes, about breathing side eliminate breathing side or remove standing water or using larvicide to yes to kill the larva in yes
Having water line in ponds and puddles
yes
to eliminate the breeding ground.
yes breeding that for our breed breeding ที่มันแปลว่าวางไข่ breeding and standard precaution for healthcare professional is use PPE, just glove and glass. Okay. If you contact case suspect this infection. Okay. And in public will education about Zika virus infection and symptom which must go to the hospital. Yes. Thank you.
Thank you, teacher.
You know, when you speak, you're thinking on your feet a lot of the time, and you're speaking in English. It takes years to get it right. You have to listen to it and practice saying the way it's said. I will take this and I will go to it and say things the way I think they should be said. You're pretty much clear at the time, but you make mistakes now and again. But if I could spend time with Amy, I could really help. Those things. That's it. And women, woman is singular. Women, women.
Finish.
Be consistent with tenses. Tense, present or past. If you're reporting something in the past, then talk in the past normally. If you're giving your opinion, you're what you think. What would you do? I would. It's not present. It's not past. It's not future. It's conditional. You have to remember these things. I will put the rest of my feedback in. Sorry to interrupt. I think everyone starts to
Okay. Yeah, thank you, teacher Molly. Thank you, teacher Kim and teacher Nan. Okay. Okay, I will close Zoom. Thank you, everyone.
นะคะ thank you น้องแม็ก thank you อาจารย์มอริส thank you อาจารย์สุภานันท์ค่ะ
ขอบคุณครับอาจารย์คิม